to the grading situation, uh, managing everybody to have a passing grade. So we're going to have to go from there. Yes, ma'am.
Why is it after 200?
It's not. Please ignore the points. I should have wrote that in an email. I can't get rid of those points. When I tried to zero them out, it just the blackboard went nuts. Don't ever look at the points. Don't look over adjusted points. The only thing that's of interest to you is for your this particular instance is that adjusted grade, that grade with the bonus points or extra points, however I framed it. That's the only thing that matters. The previous grade, I'm not going to delete the column because I did make an error for one student, and because I gave them the same grade, I just hit the wrong when you entered somebody hit the wrong button. So I want to keep them on board. Okay, all good. I got to tell. If you meet anybody else, tell them that. Never look at the darn points. I want to get rid of it. On the final, they for some reason the rubric, the way it's programmed, creates like each final question 10 times a regular question, which is not. They're all equal. And I'm not that good with computers to figure it out. Enough of my headaches. Nice, it's glad to see you, Grace.
I'm here.
And it wouldn't be class. Pick on Grace Day. Okay, let's begin. So I wanted to pick up with a couple of things where we left off, and this is really my review of the viruses. I put a lot on the board, so it saves me from doing this before. I'd rather do it, doing it before rather than doing it during. You might remember we talked about rotavirus, infantile diarrhea, and the cruise ship one with noro used to be called Norwalk virus. We touched on it. This is such an important category because the one that affects us the most. Common colds, stomach bugs, that we call them erroneously stomach flu, but there's nothing wrong with calling it that. Okay, effectively, these are uh, viruses that, because they're naked viruses and they're very small, which their name suggests, pico means billions, very, very tiny. It's like smaller than nanometers, if you want to think of it that there's picometers. And so they're extraordinarily easy to contact. The rhinoviruses are the respiratory ones. Generally, they're not a big problem because they don't have any long-term ramifications. It's not fair to say that no one ever died from one, but it would be extraordinarily rare. Same thing with the typical enterovirus, unless you're already compromised, meaning that if somebody has immune deficiency, if someone, heaven forbid, is an AIDS patient, any infection could conceivably do them in. So, which brings us to a couple, the Kawasaki and the Coxsackie. If you can read that, and you can't. On the bottom, I'm just mentioning it for the sake of completeness. I won't ask you about them. They're somewhat exotic, and every so often they'll cause something bizarre. Okay, and we just don't see them as much. It's the kind of thing that if you had a patient who was not responding to treatment, then you would do extra tests and see if you could develop antibodies to some exotic virus. It might give you a clue. The ones that are worth and important to mention are two. Hepatitis A, which you might recall me telling you, is again, these are both interesting. One is a disease that's classic fecal to oral. That was the one that caused nearly 1,000 people to get sick right around here, stemming from the old Chi-Chi's restaurant that was in Beaver Falls, PA. It came from mishandling or miswashing or mislabeling, whatever. And it all speaks to the food industry, how imperative it is to be extraordinarily careful. And what they did was they used raw green onions, spring, whatever you want to call them, scallions, chopped them up, and you just sprinkle them on for garnish in a lot of Mexican style cuisine, Tex-Mex and Mexican style cuisine. If they'd been in the sauce and cooked down as you do in a lot of other cuisine, okay, then it would not have been a problem. But that was the issue that was there. And again, 4 people died of different age groups because of this. At the time, we did not have a vaccine. There is a vaccine that I understand is effective. That's as much as I can tell you about it. The old days, we used to give people were at that time. This was 2003 in the fall, so it's 20 years ago. Uh, they were given doses of what's called gamma globulin, which is like an immune antibody booster, sort of generic antibodies that were given to them, and that was the only treatment. Now we have things that are a bit more specific like that, but it's worth mentioning because of historically and it was local. And then that brings it, and again, fecal to oral. So a lot of people were able to pass it on to others. And just like Norwalk viruses, by the time you're sick, you already probably have started to spread it. Because it's very, very hard. It gets in your clothes, type of thing. And people aren't extraordinarily careful hygienically, and not everybody is, unfortunately. There's big problems. Polio. So all of you in this room, myself included, have been immunized for polio. Polio, it's out of sight, out of mind. Even I never saw anybody with acute polio. I can't even tell you how many patients with complications of polio. Polio was known as infantile paralysis, and historically, a child could go to bed overnight and woke up. Maybe they had a little cold, maybe they had an upset stomach, and they woke up absolutely unable to move their lower extremities. They were paralyzed, couldn't feel anything. The nerves were done. And it was to some extent poorly reversible. That was the tragedy. And nobody knew what it was. They didn't know how it spread. So if a child had polio, they were shunned back in the 20s and things like that because it's catchy. Well, it wasn't catchy. It came from contaminated water. Typically, it was one of these enteric viruses, probably originally from animals who had contracted it and did not develop the paralysis, but carried the virus. And that's important going down the road when we start talking about HIV. There are a lot of times animals get viruses and it doesn't affect them the same way that it affects us, the same manner. So a lot of times we use animal hosts to grow vaccines in. More about that as we move along. So keep that sort of in remembrance. And so what happened with polio, then eventually they discovered that this particular agent was fecal to oral in nature. And it's modified over the years with the immunizations. So the team that worked on it here, and his first name was Norbert, and I'm trying to remember, he's still alive, was one of our emeriti here. He was a medical doctor in the 50s at University of Pittsburgh, who was doing his residency, worked with Jonas Salk, who developed the polio vaccine that we all got as kids. I was born in 1951. So in the mid-50s, everybody started to get it. It was Wonder Drug, okay, because polio was a scourge and started to eradicate it. After he died, a colleague of his, who I think was also a relative here at the University of Pittsburgh, named Sabin, he identified that it was fecal to oral. And at that point, you have to have a relative old enough to remember this, so someone my age, at that point they converted the vaccine. It's called trivalent. There are 3 strains. So you had to get, like with typically polio immunizations for children, they do it 3 times. They do it early. And so there were 3 strains that were identified. And at that point, he developed an orally active vaccine. And what we did not as a community, when you talk about entire vaccinating the nation, okay, we all on maybe at monthly intervals in the mid 60s, I'm going to say 65, 64, that area, we all went as families to, whether it was the church or the community center. Ours was at the high school in our town. And on 3 consecutive months, all the doctors, all the nurses, all the health professionals basically walked in, they crossed your name off the census, they gave you a tiny sugar cube, because we used to put cubes of sugar were common, and you put a drop of this vaccine, which was red in color, so you could identify it, and basically what they watched you put it in your mouth and let it dissolve. A little context for this: I'd had one of these for the second one. I stayed over at my buddy's house, who's now an attorney out in California, and I remember to this day his dad calling my dad, "Hey, we're going over to high school. We'll take Lou over." And my dad said, "Okay, we're going over a little earlier than you are. I'll tell him it's okay." Could you imagine now taking a 15-year-old child and getting them vaccinated without a parent? People were not so crazy about legalities then. It was much more of a community effort. That's an interesting, if you reflect on that, it's interesting. I always tell that anecdote. So, and now the vaccine has changed yet again. I was reading up at that on this in preparation for this presentation, and I think they're doing it back by injection because I think they modified it again. And it's been modified multiple times. But the big player here is we were able to effectively eradicate a disease that's extraordinarily rare. It causes a paralysis so terrible that many people died. In the old days before respirators, they put them in something called an iron lung. Look up polio, just Wikipedia it, And look at some of the images. You'll see children in iron lungs because their respiratory muscles were paralyzed and they got terrible contractures. Because what happens when muscles paralyze, if they come back, flexors overpower extensors. It's just fascinating. We used to treat a lot of people with deformities because they had difficulty walking, etc. Very fascinating disease, very interesting historically. I mean, remember his name is going to come to me in the middle of the night. Moving on. Sorry for the diversion. This is easy. Rubella. Now, normally you would not think of this as a disease to worry about. You're immunized for this. The magic of MMR stands for measles, mumps, and rubella. Okay, chickenpox came after. Those four were the usual childhood diseases. As a child, I had 3. I didn't have the mumps. I was later immunized for the mumps when we were about to try to have kids because there could be problems attendant with that. So to make sure of that. But rubella is the poster child for why, and we talk about this again when we talk about respiratory diseases and skin diseases. Rubella, in this case, these are spread, interestingly, respiratorily. Very easily spread, even though it's enveloped. Toga means cloak. So they identified this first microscopically. Look at a cloak. So they gave it that name. Chikungunya is relatively rare. You typically, people going to the islands first identify it. It's carried by mosquitoes, so it's more zoonotic. That had come on ships that were coming from Africa with produce, and they had a lot of mosquitoes that went in. And one of the early stops was over in the Caribbean. So that was really where we first saw it, there and in South America, because the climate was more mosquito friendly. More about that as we get to it. When we talk about vectors like mosquitoes, the way you do it to control the vector controls the disease. So that's why we have areas in this country where we spray for mosquitoes all the time. If you have a pool that's not being serviced properly, you get all that green stuff in it, and it kind of stagnates, that's like a breeding ground for mosquitoes, for ticks. Well, that stagnant water is a bad guy. So if somebody in your neighborhood has one of those and they're not taking care of it, I'd be a knock on the door and say, let's get after this, please. Maybe once or twice. Then you might have to call somebody. They'll get them taken care of it. I mean, I normally never do that, but, as a pool owner, now we've removed the pool so we don't have the problem. But it's something to be considered. But rubella is the German measles. Again, rubeola, typical measles, because the little spots were ruby red. Roseola, they were rose colored. These, I don't know how they derived the name. It's very faint. You could hardly see the rash. You hardly knew you were sick. The only thing I can remember as a kid is right here, what they call preauricular nodes. Your lymph nodes here felt like 2 little golf balls that were sore. Got it right before the junior prom, might I mention. Yeah, just offhandedly. Long story short, with regard to that, this is the one that was dangerous to the newborn. It crosses the placental barrier. So a lot of people were minorly sick or didn't know they were sick. And if they were around somebody who was pregnant, particularly in the first trimester, we saw a tremendous amount of problems. We do not see it as much. If you ask ask a grandparent, okay, if they recall in their school how many kids either had hearing aids or speech class or difficulty speaking, speech or hearing problems, rubella. Every class I was in had that. I had teachers with hearing aids and they were rubella. There's something called the rubella bulge when they have problems with the vaccine, and we saw an uptick in it. It affects special senses, particularly sometimes sight, but hearing would be number one in it. So that's another reason why we take those vaccine type precautions that are there. Rubella is a big player in that. So that's the one that's most notable there. Yellow fever. These are effectively all transported, save hepatitis C, by mosquito vectors or similar, mostly mosquitoes. You certainly don't have to know the species. Okay, yellow fever, classic for that. We first discovered it, it was there forever, but we first became acquainted with it when they went to dig the Panama Canal back at the turn of the last century, in the late 1890s. And digging that canal, a lot of the workers came down with this, and they identified that it was common for the natives, and they were able to actually identify the plant that will come to that that were used. They were quinine alkaloids. There's a plant that produces that, and a lot of our remedies for malaria come from that. So they used a similar thing in order to treat. So they had ideas then about the treatment, and we get to that in antibiotics, and antivirals, and antiprotozoans. But nevertheless, it's why it's called yellow, and flava or flavis implies yellow color. Like riboflavin is a vitamin. When you administer it, as many of you might with nurses, you'll see vitamin supplements intravenously as yellow because they have that color. That's vitamin B2, as I recollect. Thiamin's B1, riboflavin's B2, I think. And I know, I remember this stuff. Useless, fountain of useless information. And moving on, what happens is it affects the liver, and when it affects your liver, we get a thing called jaundice. Jaundice means that and you should be learning about that, or will, in anatomy and physiology. What that, when the liver is damaged, you can't process out the heme fragments in bilirubin, and bilirubin colors urine and feces. But if it backs up in your bloodstream, you become jaundice. And so jaundice is characterized by a number of these. Dengue is the way it's pronounced. That's something that if you go on one of these learning opportunities, a lot of the nurses used to. And did they go to Ecuador most recently? Somebody refresh my memory. But we used to go down to Nicaragua. I don't think it's quite as safe as it was, but they were. Dr. Ross has a lot of contacts in that. That was the one they worried about the most. That was there, and again, you take precautions about that. Zika was something that was identified with microcephaly. They started because they were in toward the Amazon for the World Cup in 2014 and for the Olympics in 2016, and some of the venues were near the Amazon, and some of the babies being born had actually smaller heads, and it was actually carried to Miami for some reason. Whether there was a shipment of something going there and some of the mosquitoes, though it's not that common. But again, the big thing to know about is yellow, associated with liver problems, and certainly the oddball here is hepatitis C. When it comes to hepatitis A is treatable and not typically fatal. Hepatitis B is controlled now because we have a very satisfactory immunization. Hepatitis C, for the longest time, we had no treatment. There is much more progressive treatment now. It is a classic sexually transmitted blood and body fluid disease, most commonly through needle sharing or tainted blood. The biggest diseases that were spread before 1987 in transfusions, before we knew better, were HIV, okay, and hepatitis C. Now, after 1987, the blood is checked for that. People pre-1987 who got transfusions were at risk. I was married to one. My wife most likely contracted or was exposed to hepatitis C when she got a transfusion back in 1981 when she was having her ovaries, they called wedging it. I don't know what the name of the procedure is, so we could try to have children, biologically. And we didn't know she had a bleeding disorder that was comparatively mild, but unfortunately they didn't know to pre-treat her. And so she got a bad abdominal bleed. They had to give her 2 units of blood, Hep C positive. And when she got ill later, 23 years later, they discovered that that she now had a distinctly positive titer. And even to this day, because her health has been unfortunately on the downhill, my kids who basically are, on top of her health care, as is she, were advised that if she really gets sick, that hepatitis C could be bad. Thankfully now there's treatment for hepatitis C, but right now, as far as I know, there's not an immunization. But we have some good antivirals because they're working more on how it replicates more. So I'm going through these rapidly, comparatively. I'm trying to highlight film this for you. Okay, is what you're going to have to know. On that study guide, you'll see the things that you have to know. A lot of these are about it would be a typical chart. I can tell you exactly what the answers are: fecal to oral, respiratory, zoonotic, blood or body fluids / STD. And I'll give you a disease, you pick it out. I'll give you a category: rhinovirus, orthomyxo, paramyxo, flavivirus. And I'll give you a disease. You match them up. You already know what's coming. You don't have to thank me. Money will do. Money's always good. Didn't say that. I was joking. I'll give you my Venmo. I didn't even know what that was. Okay, moving on. So far, from a standpoint of looking at these, I've missed Corona. How could I do that? Everything so far here is isometric. These are all enveloped. This is the one, and they call this sort of unique envelope a crown, hence the name coronavirus. Okay, a typical cold virus. To be fair, the structure in here is probably in that pleiform. It's got different little segments of RNA, and unfortunately, it loves to mutate, as a lot of RNA viruses do. And so little pieces kind of flip-flop positions. You'll see it better when we look at influenza, which really is the reason why influenza is so seasonal. So we're getting to the point where corona is going to become somewhat seasonal as well. The good news on that, most of the time, the seasonal variations are not hard to deal with unless we get effectively what happened was a mixture, because it affects multiple species. It became what's called a novel virus. NOVEL means new and never seen before. And what happened, whether it happened in a lab or in an open air market or wherever it came from, and that's not clear. Let's be aware of that we don't know if this was some type of inadvertent release of a weapon, that was being developed and unintentionally, or whether it was just what they're saying as the typical way that these viruses come when you have a lot of animals or slaughtered animals, and that virus is kind of looking for a place to hide. It gets involved in multiple species. So a piece of different species came together inside this little package of RNA and became something that was deadly and caused bizarre. And the way most viruses hurt you, as you will see, and we get to it a little bit later in this chapter, is your immune system. Where bacteria typically make toxins, viruses are foreign, and they cause foreign proteins to either be in your bloodstream or protrude from cells, and your immune system goes absolutely crazy. And that's exactly what happened with COVID. And I used to do a whole program on it. I'm doing it less now, just as a matter of time. The first time we heard about this was called severe acute respiratory syndrome. We knew it was a coronavirus. The name was up there, SARS-CoV, which stands for coronavirus 1. That we identified that when somebody got in a plane in Japan and ended up in Canada, and a whole plane load of people got sick and some of them died. They thought it happened after 9/11, so they thought it was a bioweapon. It was not. It was just the problem with traveling in an enclosed environment. Middle East respiratory syndrome was another variant of that was considered novel virus. It did occur in this country, but most time the exposure came from our soldiers and our military people and the other people helping with the military, or part of that package that was out there during things like Desert Storm and various activities were out there. That was at the same time my son was out there, but he was on a ship in the Gulf at that time. So that was MERS, also a problem. And they have it in a couple of little spots. But COVID-19, the one that impacted us so much, was still coronavirus. Its fancy name was SARS-CoV-number 2. And so that's its name, sort of scientifically speaking. And again, it's this sort of interesting novel virus that we're starting to see. Occasional mutations that are problematic, but in general, some of them are a little bit easy to spread, but most of them are now more like cold viruses. And governmentally, we're seeing the restrictions change. They've taken away a lot of the restrictions. But it's like what happens now, probably, and if it stays warm like this for another month, then you'll be able to go into the hospital, whether you're visiting a sick friend or getting a blood test, or an X-ray, without having to wear a mask. But right now, the mask protocols went back in place in December. Different protocols, different places. So that's, and we'll deal more with that in the respiratory area. But again, as far as we know, these are all respiratory spread. These are the two really classic filamentous viruses. The first, and it's fairly large, rabies, okay? So it was easily identified. I can, to this day, remember my virology professor making a drawing of a bullet. I think I showed you this. And so this is what we know about a virus. It's got a protein shell and some kind of genetic material inside, period. That was 50 years ago. We know a lot more. Rabies is an enveloped virus. It's been around for a very long time. It affects nearly every mammal. So dogs, cats, us, rats, raccoons, bats, they have all potential. And the presumption is, and I'll say it many times, if you are inadvertently bitten by or come into close contact with an animal and you do not know if it's rabid, you have to presume it's rabid and treat accordingly. And it must be treated because rabies is fatal. Rabies is spread by definition zoonotically, though it can even be human to human. Okay. But when they do these classifications, it's how it's typically spread. So it's typically classified zoonotic, typically bitten by a rabid animal. There's a lot of different presentations of rabies that we look at in neurological diseases. For now, the difficulty, and the reason I say human to human, we had a friend of ours, where Children's is now in town in Lawrenceville. That whole area used to be St. Francis's main hospital. They had a big psych unit and a drug and alcohol detox unit. I was on staff at St. Francis for 10 years. But I didn't operate at the one there, I operated at one down where the arena is now, where the Penguins play. And one of our neighbors was a psych nurse. And they had a guy who was crazy, and she went over to treat him, and he bit her. For you future nurses, be wary. I'm telling you, patients get scratch and bite and other stuff. If you didn't hear this now, you're going to hear it a lot. It turns out when he died a few days later, in the postmortem, they identified rabies by what was in his brain. So you had to get what's called the rabies series. That was a series of 14 days of intraperitoneal injections, which were unbelievably painful. Thankfully, now it has changed. Now we have antibodies that are administered intramuscularly, and a lot of people end up having to get them, and most of them work in a veterinary. Either veterinarians or people work in veterinary animal shelters. So, and they have a protocol for that. So it's much more friendly. Back in the days, it was awful. It was awful. So, and again, look, you're going to know people who have had things. The longer you're around, the more of these anecdotes kind of float your way. So be watchful about rabies. Who to watch for when it's you, or maybe you have younger siblings or children in your family that when you go to family things and they're out for family reunion out in the woods, keep them the heck away from, oh, how cute the squirrel is. Rabbit. Chipmunks. They all think they're doing the squeak wall. Alvin, Simon, and Theodore. Oh, we're going to go pet the chipmunks. My daughter was like that at a Y camp. I'm yelling at they were all girls. It's like, don't go there. And bats. Not that I want to have a social life with bats. Bats are very interesting research-wise. And they carry that virus is transmitted frequently in their urine and their guano. That's bat poo-poo. So you don't want to go into the bat cave. So little advice here. Watch people. A lot of people like to go caving and what's called spelunking. There's a lot of problems with moist, wet environments like that. Just saying. My stepdaughter wanted to do research with bats. She was out in the middle of the night doing research with pollinators in Virginia when she did a program there in college. It's one of these summer enrichment programs. So moving on, gives you an idea of the severity of rabies that was there. to be fair, I like the chipmunks. I watched a lot of chipmunks movies with my kids and my grandkids. They came out when I was 19, like late 50s. So I was a kid then too. Ebola. Okay, if you didn't hear about it, Ebola, when we started to teach this, Ebola had a death rate of somewhere around 80%. We still don't know for sure how it spread. Okay, it could be, we saw originally it was zoonotic. Then we saw it was contaminated waters. And it was occurred almost exclusively. We had never had a case in the United States. And then people from Doctors Without, there were outbreaks in sub-Saharan Africa. And what they used to do, basically, they thought an animal that was infected fouled the water supply. They all basically used the same water supply. The village would get sick. What happens is, it's a terrible virus that in a matter of days causes leakage in blood vessels. Organs get clogged, they start to die, pain is intense. The reaction is violent, and they basically die in less than a week, maybe 3 to 5 days. And the treatment was very simple. The treatment was quarantine, except it was quarantine until, and the phrase they used, we're going to let it burn out. What that meant was everybody who was going to die died, and then the virus couldn't travel. That was the treatment. I'm not saying it was a great treatment, but we didn't have any other treatment. They started to have more outbreaks in the last 7 to 10 years that were coming close to coastal areas like Liberia and Syria, Sierra Leone, Ivory Coast, that neck of the woods. They were more on this side of Africa, closer to the Atlantic to us. And they had a number of doctors going there, and one of them got sick, as well as some other people, and they literally brought him back. There were about 5 or 6 hospitals that were aware of the procedures. One was Emory Medical School Hospital in Atlanta, so they felt that they could treat him. We learned a lot about treating them. It is very, very hard. It's so easy to decontaminate, to use that term. You could be in there in these hospitals. Hospitals have wooden floors, super hot in Africa. And you might end up going on a medical mission or work for there, many of you. And they were all, for 45 minutes, you were gowned, gloved, rubber material to prevent you, ventilating masks on. You come out, you couldn't just take them off and go through decontamination. You had to have another person reading the manual, because you had to do it in a particular step-by-step fashion, because it was so easy to cross-contaminate yourself. And don't think of this as being, I'm telling you the honest truth. You have to be very cognizant of that. They had a couple of nurses got sick. They brought a man over who they didn't know was sick, tried to treat him at another hospital in Dallas. They said they knew how to do it. They didn't. One of the nurses there got sick. Okay, died of Ebola. There's, and we had never had a case, much less a death. So it's now that we know more about it, the rate and the ability to treat it has probably lowered the death rate under 50%. That's one of those potentials. So historically, it's very interesting. All techno thrillers and stuff about that all the time. There was one with Dustin Hoffman back in the day. I'll remember the name down the road, which is not a great movie, but it was interesting. Okay, and so so their filamentous, rhabdo, and philo are both like that. And we're making good progress here. I'll get these two, and I'll probably talk about it. Maybe I'll record some information and get the rest to you, because I do want to spend a fair amount of time Friday. So I'll have time. Thankfully, I have time this weekend to do all that. My wife's going to be with her mom. It means it's me and the TV set and the animal population. Moving on. So these are also oddball shapes. So I don't go by the shapes, even though that looks somewhat isometric. Para and ortho mixo. Okay. Mixo means mucus. So these are respiratory viruses with flu-like symptoms, coughing, sneezing, bringing up stuff, that kind of stuff. Okay, the most famous of these is ortho means straight, para means alongside. Not a big deal. These, again, are ones that have a strong tendency to mutate. I'll start with the paramyxo. The four diseases I wrote up there. And we don't see a lot of mutation, but you could. Measles, a dreaded disease that we are all immunized for, but in sub-Saharan Africa, what we're talking about, third largest killer. It's not innocent, particularly for adults. Everybody my age had the measles. Everybody. Before they had the immunizations, everybody. That's why it's one of those resurgent diseases. People are just not, and maybe for good reasons, don't want to have vaccines. I understand it. You can't tell somebody how to live. You can't. Mumps, less of a problem for children. Their face swells up. It affects the parotid glands, the salivary glands here. That one, even though it's respiratory, it affects the digestive system. Measles affects the skin. So how it's spread doesn't mean it's going to affect a specific system in a specific way. And the mumps, the big problem, again, in most of these you can see a recurrent theme. With adults, big problem. Adults, it causes glands, not just here, but it can, in men, adult men, testicular glands leading to impotency, women, ovaries leading to infertility. It's a real problem in adults. And adults don't do what kids do, which is sit in bed and do nothing. Adults have a tendency not to be as cognizant of that. Paramyxo means para-influenza, and it's like a mild flu presentation. Because we'll conclude with flu, I'm sure. And lastly, and it's important, right now in the winter around here, we talk about the big three. The big three are influenza, which we're going to get to in a second, COVID, which we got to, and RSV, stands for respiratory, fancy word, syncytial, Synctial. You all had heart anatomy by now, didn't you? The heart, all the muscles in the heart are called the syncytium. They're networked, one's attached to the other. What syncytial viruses do is they cause the lung cells to kind of fuse together. You'd imagine heart. This is famously called, it was infantile respiratory distress. It's common in preemies, because preemies didn't make it until around 26 weeks of gestation. Surfactant. We'll talk about that when you get to the respiratory for something really high. And that surfactant is a wetting agent that allows the lungs to expand and contract without sticking. That's the problem with RSV. And so if kids get it all, my kids have it. In older kids, toddlers, it's called the croup. Have you ever heard a croupy cough? It scares a parent to death. Because they make kind of like a whistling sound when they try to exhale. And now with the coolness vaporizer and stuff, it's not a problem. My kids were little, me, because my wife couldn't get back to sleep. We have to put them in the bathroom, turn the shower on full steam, close all the windows, and sit there. It's a deal. Right now, we're seeing a lot of older adults. My mother-in-law in the hospital now she's elderly at 97, but last year she was in the hospital with RSV. My wife was down for 10 days in September with RSV. Coughing, hardly could breathe. It is not innocent. So we're seeing a lot uptick in that. So that's why that's one of the three. And that ends us, conveniently enough, with orthomyxoviruses. And orthomyxos are interesting. That's influenza. There's different presentations. And influenza A is the one. And for years, that was our worry. Even when COVID came out, they thought it was going to be similar to swine flu or Spanish flu, different influenza outbreaks that we thought would have the same kind of devastating effects described to COVID, a novel virus. Why influenza does this, and to some extent why COVID does it, is this. Influenza, I'll just sort of generic enclosure, has 7 to 8 identical strands, of RNA. So they're identical strands. They're not arranged linearly like that. They're sort of all rolled together. And in their proximity, you can get a little piece here, switch places here. and a little piece here switch places here every time it replicates. So that's a mutation. You're moving genetic material around. It's an RNA mutation, it's a mutation. And that mutation affects what are called the protein spikes. Remember viruses, how do they attach to it? Protein spikes. We're going to go over this more than once. So as it's here, surrounding it, it has spikes that effectively, it's a sphere, so they're all over. And the spikes alter. I just did it this way, and we have a name for them. Okay? This one's N, this one's H. This one's N, this one's H. And we have identified over time influenza effects. Bird family, pig family, us family, horse family, other mammals, bat family, all of those types of things. A lot of mammals get this. The spikes, the reason we use H and N, H stands for something called heme agglutinin. When we get to respiratory diseases, this is how it attaches to one of your cells. The N stands for another enzyme protein, neuraminidase. And that's how it neuraminidase. They look that up. And that's how it escapes from the respiratory system. So we refer to them as H&N spikes. So if you got a flu shot, or back in 09, you probably wouldn't remember it, maybe you would, they had an outbreak of a swine flu that was classified as H1N1. And that's how we classify these: influenza A, H1N1, H5N1, H1N3. So we know of different variants. There's about 17 H variations and about 9. And we're going to get to that in respiratory disease, but therein is the problem. Problem is because of it rampantly mutates. That mutation is a fancy name. It's called, and we'll get to that in respiratory, it's called antigenic drift. Subtle little changes that render flu vaccines ineffective season to season. Every season we have to kind of take an educated guess epidemiologically about what flu vaccine to make and hope we get it right. That's why I don't do them anymore. Last time I got a flu vaccine, I got the flu because it didn't mutate. Okay, and it's more of a concern for people who are older. The recommendation now from the CDC is still that everybody should get a flu vaccine. It used to be the very young, the very old, people with underlying problems or respiratory diseases, and people who worked in close contact with a lot of others, healthcare workers. Now they changed the recommendation. I don't buy it, but that's okay. And the one we worry about, and again, this is going to be not on this test so much as the next test, are these killer strains. That's just like COVID, where they're on a farm and all of a sudden you get multiple members of the family and they each kind of share flu viruses and they mutate inside another animal. And so you get a little bit of bird with human, a little bit of horse with pig, and all of a sudden that's expelled and the farmer contaminates something and then the world goes crazy. That's everything for today. I'll give you a little bit on Hanta. We don't do Lassa. I don't do hepatitis B these days. I will present some stuff. We revisit HIV a couple of times. And we'll get everything done. I'll send you some stuff and we'll do the review on whatever. Thursday. On Friday, right?